A number of hospitals around the country are denying organ transplants to people who are not vaccinated against COVID-19 or bumping them down on waiting lists. This raises some ethical questions over the decisions. In one highly publicized case, a Colorado health system denied a woman a kidney transplant. The patient refuses to get a COVID shot. The patient refused, rather, is what it should say, to get a COVID shot because of her religious beliefs. Joining us now to discuss this case
children
is
that were really sacrificed up for the advancement of medicine, and for me, as a sanctity of life person, I can't move forward. So there's this policy put in place for something that could happen versus not getting a transplant, which could 100% lead to the end of my life.
Joining us now to discuss this case is Arthur Caplan. He's a professor of bioethics at NYU Grossman School of Medicine. This isn't just happening in Colorado. It's apparently happening in hospitals across the country. So the big question here is it ethical to deny an organ transplant if the patient is not vaccinated against a contagious disease like COVID-19?
I think it is. And the reason is, if you have a disease like COVID, when you get immunosuppressed, when they give you drugs to prevent the transplanted organ from rejecting, it's really likely it's going to flare up. As a matter of fact, you require flu shots, measles shots, tetanus, booster update. So the centers are basically doing what they usually do, which is to say, we can't put you at risk of dying from the transplant. We can't lose the organ. You've got to be vaccinated.
I don't know if, when it comes to issues of ethics, if there's sort of a set protocol that the medical community discusses. But we know that the University of Colorado Hospital cited a study that found that transplant patients who contract COVID-19 have a mortality rate of 20% or higher. Would that be enough to justify a denial? The fact that they stand an increased risk of, not surviving?
Well, I know that study, and that just traced out transplant survivors, if you will, for a year. You're taking those drugs for the rest of your life, as long as you have that kidney or that transplanted organ. And so the COVID, if it gets into your body, could kill you at any time. So I'm going to say many transplant centers are just going to say we can't face those kinds of risks. We have too many other people who are likely to do better, both survive longer and have a higher chance of survival. And I think that is defensible. We try with the scarce supply of organs, and let's hope that we get more. We should all be organ donors. But when there aren't enough to go around, you've got to make some hard calls.
So do hospitals have legal standings in these situations?
They don't. It's basically the transplant team. The way things work is each individual transplant center sets its standards for who it's going to put on the list, Colorado, NYU, Stanford, whoever it is. And then we have a national waiting list. If you're admitted to a center, you're put on that list, and then distribution occurs. But there are many, many programs that are going to say, you've got to be up to date on your vaccinations. Giving you a transplant and those drugs that are going to tune down your immune system is just too dangerous.
In the case out of Colorado, the woman cited her religious beliefs for not getting a COVID shot because of the role that fetal cell lines played in the development of the vaccines. And I'm not going to give people sort of a big definition, but people should know that when we're talking about fetal cell lines, we're talking about the very first cell when it came to sort of research and development, and that was used many cells ago. So we're not talking about a direct link between fetal cells and these vaccines. It would have been, I guess, biological. I should really let you, doctor, explain it, but we're not talking about a cell that was removed. We're talking about something that would have happened, decades ago. Anyhow, right. Keeping that in mind, are any of the COVID vaccines, let me get you to clarify. Are any of the COVID vaccines made with fetal cell, and what about a religious exemption?
Well, what you're basically pointing out is, do the vaccines contain fetal cells? And they don't. Mm-hmm. Have they been tested against cells that were derived or produced many decades ago from a fetal cell? Yes. All the vaccines are tested that way. And the problem that people who raise that religious concern about using a vaccine that's been tested against cells that were made decades and decades ago, starting with a fetal cell, is that almost everything in medicine is made that way, including those immunosuppressive drugs you have to take if you're going to get a transplant. And by the way, many over-the-counter drugs are tested against those cell lines. So just to say I'm not going to accept the vaccine, but then accept the rest of medicine, accept the rest of over-the-counter medicine, doesn't make any sense. Should also add, the Vatican, for example, has spoken out and said it is acceptable morally to use vaccines that were tested against cell lines that were derived long ago from fetal cells. So while a person could certainly raise the objection, it should be noted that, you know, religious leaders in the traditions are basically saying you've got to protect yourself and your neighbors.
So we should note that CBS News has reached out to the University of Colorado Hospital, but has not yet gotten a response. Professor Arthur Caplan, thank you very much.